Dr. Lexi Hill, maternal fetal medicine specialist and medical director at UMA Health.
We are going to visit now about the management of someone who has been diagnosed with preeclampsia. So first off, let's talk about those that have preeclampsia without severe features. We definitely want to complete a maternal fetal assessment. So this is going to be an assessment of the labs. Looking at liver function, kidney function, and platelet counts are very, very important, and those can be repeated. An ultrasound as well to make sure that we can see the size of the fetus, checking the biometry measurements, looking at the fluid around the pregnancy as well, that amniotic fluid level, and then also fetal heart rate monitoring. So this can be done with the ultrasound, seeing what the fetal heart rate is, and also placing a mom on continuous electronic fetal monitoring so that the top part is the tachometer and we can look for contractions, and the bottom part we can see a continuous electronic monitor of the fetal heart rate and see how it looks. Also, with these patients, we want to determine if they are a candidate for outpatient management. If you're managing someone outpatient, we definitely need close surveillance to make sure that they don't ultimately develop those severe features. Frequent visits, this would be individualized, and blood pressure surveillance. They can check their blood pressures at home as well as in the office on a routine basis that can be individualized per patient. Fetal assessments. This is some type of antenatal surveillance, which can be through a biophysical profile, which checks for baby's breathing, movement, tone, and fluid on an ultrasound, or some type of a non-stress test where they're placed on a machine in the office, or some type of a mix of those. And finally, labs. Just like those that we looked at for the initial diagnosis of preeclampsia, those can be repeated typically on a weekly basis, maybe more frequently, depending upon any symptoms that the patient may be developing or that may be worsening, and you can individualize that for each person. What if we have preeclampsia with severe features? These individuals definitely need to be admitted to the hospital, so they don't get the option for this outpatient management. Again, for the complete maternal and fetal assessment, very similar to those who do not have severe features. The labs that we mentioned before, looking at a complete blood count, as well as the liver functions, kidney functions, and looking at that urine, that can be performed. Ultrasound, just as we mentioned before, for the size of the fetus, the fluid around the baby, and then also that continuous electronic fetal monitoring, typically on their admission, and then deciding inpatient how frequently you want the patient to be placed on the monitor, and if you want to perform any of those biophysical profiles to check for the baby's well-being thereafter. The other thing that we're thinking of with these individuals who have concern for severe features is corticosteroids. So we want to stick with the same recommendations we have in the obstetrical patient for the administration of antenatal corticosteroids with betamethasone for those who meet the gestational age requirement for those recommendations, and also magnesium sulfate. This is our smooth muscle relaxer that is going to try to decrease our concern or the risk of a patient having a seizure, which we would then call eclampsia. And then finally, for management of these individuals, we want to make sure we are treating those blood pressures that are in the severe range. That's going to be systolic blood pressure greater than or equal to 160, diastolic blood pressure greater than or equal to 110.